Yaki kubor kerpang hakabede bad u COVID-19. U Menteri Rang Badu Keri u Narendra Modi u lero akilat bad kisenjam balashim da kitnat sorkar bapher ban syakri yakeri hapadeng kejingke ka klam COVID-19. U Menteri Rang Badu u lero ikitua kibatrei baro arpesau kenta ban penbiang ya kijingdon kam boarding hakari. Syo ulong bak sorkar ka IT lot ban yarap yaki kam lajong nadu kibaret tam hadu kibahe atam. Bad kan penti kena bakan ajing yarap kat bala ya kitua kibadan kam. U Menteri Rang Badu ulong bo usngo sarong ya ka kenhuan jo katenat ki kamrel jongkari kabayarap klem syong thaj ikinong syong shnong hakane ka por badan kejing e. U Menteri Rang Badu ulong ba ka perthehi baro lang kaya khun persya ya kejing pang COVID-19 bad ki breu ken sa job ya kane ka klam. Ka jingdon ki bayo e kejing pang COVID-19 hagri India kalakiyo sya ka khatsau hajar laispa nyopo prangut. Bat ka jingdon ki balayap kalakot sya ka sauspa prapongut. Kumba si hajar khandai spa khandai puwengut ki briopat ki lakot bat lapelat no yaki. Ka jela Maharashtra kadon bon e ki balayo apang kabalong lai hajar laispa arpulaingut bat arspa iwengut ki layap. Bot sedaka Delhi hagaba si hajar nyospa nyongut ki layo apang bat ha Tamil Nadu kidon si hajar laispa arpulaingut ki balayo e kene kejingpang. Ha kejela Madhya Pradesh hendriup kendai ngut ki beriu kilayap na kejingpang bat ha Delhi saupu arngut kilayap na kene kejingpang. Urang ba snong kesnong pamlakrai ka bahap apo ka Milliam Block ulong yaki beriu baro ban peni ya kejing snolem bat bandon ka mensiam yarap yaki beriu bat kilong yeng ki balasya akta ha kejingpang COVID-19. Iwei na kinong yarap yaw balayo nengkong e kene kejingpang ha kejela idei ibasa ha pamlakrai. Bat la syam iru ilong positif ni ilayo e kejingpang COVID-19. U Commissioner bat Secretary katenat kakot kakia kejela Meghalaya u Sampat Kumar ulalit jingo e kene kesnong rengkat bat u Block Development Officer bat ki doktor banyakran bat kesnong bat kumjo bat kene kelongyeng henne ke step. Kam hadien uli tho bak sorkar kelapen sngau tho bat penklanya kene kesnong ba kan la benele persya e kene kejingpang klem ka jing syaptiang henrei da kejingkit clear. Ha Meghalaya sa arngut ki breu kilayo ya report bagi long positif ne bikilayo e kejingpang COVID-19 henne kesngi. U Menteri Rangba kejela Meghalaya u Conrad Kongkal Sangma uliathu bada kini kejingdon ki balayo ya kene kejingpang ha kejela kalakiyo syakishpongut. Kini ki arngut badang sulap kidei iwei bahayeng jong unong pang ubalaklat no bad iwei pat idei bejiarap kam hayeng. Ha kawai pat kaliang ka Deputy Commissioner ka District East Khasi Hills ikong Matsiudor War Nongbri ila kren sikirang ba asnong bat kiwei kinong yalam niam halor ka jinglong jingman na ka jingpang COVID-19 ha kanong ba silong ha ka jingelang ka blalong henne kesngi. Ka jingtmu jong kene ka jingelang kalong ban petsngoto halor ka ei ka badai ban le ha ka bedai bat kene ka jingpang. Ha kene ka jingelang ki balawane shim benta kilekli ki jingkli bedai halor kumno uni uknyang jingpang usapriang kumno ban tep nethang yaki bayap na kene jingpang bat kumno ban penkerpang yaki beriau ki balalap bagi don kene jingpang haba pensyai kini kimat u director ke health services u Dr. Amanwar uloong ba kababahatam kalong ban syutang yakamet jong ki balayap na jingpang COVID-19 uloong ru bauni uknyang jingpang ummi lengba keseni edo henry ki beriau kila aban yo yauni uknyang jingpang tang lengba ukumut ki kemat bat kesentur. Baro lang ya shispa sapwe teli kinong muna ne ki sample jong ki breu kentup ya ki be syong kalilang kinong sumar bat ki bahayeng jong ubreu balayo ag jingpang COVID-19 na Dimapur lalum bat pha bantes. Yau ne ubreu lalap ulayo ag ne jingpang ha ka Guwahati Medical College and Hospital ha Guwahati ha jela Assam men ha ka khat arterik menta ubna yayong bat menta udang don ha pedang ke jing sumar ha ka hospital ha Guwahati. U Principal Secretary ketenat Korbari kejela Nagaland u Abhijit Sinha uliatho banekinik shispa sapwe teli kinong muna balapha test. Ya ke result jong shispa lai puprateli layo balasyam bakim patshim layo ya kene kejingpang. Ya ke result jong laingut ki weipat dang ap hadu menta. Baru ki district Nagaland kliatho benya ya kejing penkre jong ki benelek persya ya kene kejingpang. U Menteri Rangba kejela ulayaro akilat balashim bad ula ai jingmot ki officer banlong ki bapet ngor bad banang penklan syu ya ki jing penkre. Paralok nong sngap leo sngo mentan ki kubor kerpang ha ka bedai bad COVID-19. yak balawalam shapi Dhaka Regional News Unit jong All India Radio Shillong.
This is All India Radio Shillong. We now bring to you a special roundup on COVID-19. Prime Minister Narendra Modi appreciated the efforts and steps of the various government agencies for serving the nation amid the COVID-19 pandemic. In a series of tweets, Modi gave kudos to all those working around the clock to ensure country's energy need. He said government is committed to help dynamic change small and medium businesses and is ensuring all possible assistance to those who need it. Modi said he is proud of the Indian Railways team, which is continuously helping citizens in this crucial hour. The Prime Minister said the world is fighting COVID-19 together and humanity will surely overcome this pandemic. The number of COVID-19 cases in the country has climbed to 14,378, while the death toll rose to 480. Health Ministry data said the number of active COVID-19 cases stood at 11,906. As many as 1,991 people have been cured or discharged. The headman of Pomnakrai village under Millim block has asked everyone to show empathy and take care of the people and families who are affected by COVID-19. One of the helpers of the first COVID-19 patient, who is among the people who have tested positive, resides in this village. Health Commissioner and Secretary Sampath Kumar visited the village along with BDO and medical officer to interact with community and the family this morning. Later he said that the government is building awareness and capacity of the community to deal with the disease without fear but with responsibility. In Meghalaya, 2 new positive cases of COVID-19 were reported today. In a tweet, Chief Minister Conrad K. Sangma informed that with this, Meghalaya have a total of 10 active cases. Both cases are from the house of the first patient. One is a family and other is a helper in the house, informed the Chief Minister. Meanwhile, District Commissioner of East Khasi Hills Mwar spoke to the Rangbashnongs and other religious heads on the COVID-19 situation in the city at a meeting convened today. The address was aimed at creating more awareness in handling of COVID-19 cases in Meghalaya. During the meeting, traditional heads, religious leaders and community leaders raised many pertinent questions relating to COVID-19, like how the virus spread, how to cremate or bury people who died of the virus, and also on the issue of how people who have been tested positive are quarantined. Clarifying on the points, Director of Health Services Dr. Aman War told that the best possible option is to cremate the body of COVID-19 positive patient. Dr. War also said that the virus does not penetrate through the skin, adding that people can get the virus only through the nose, eyes and mouth. In Nagaland, altogether 141 samples of people, including co-passengers, healthcare workers and family members of the COVID-19 patient from Dimapur have been collected and sent for testing. The patient had tested positive for the virus at the GMCH in Guwahati, Assam on April 12, where he is currently undergoing treatment. Nagaland Principal Secretary Abhijit Sinha, in a statement on the COVID-19 situation in the state, has said that out of the 141 samples, the results of 138 have been received and all are negative. The results of 3 samples are still awaited. The districts gave a detailed briefing on their preparedness and highlighted various issues. Rio praised everyone for their efforts and advised the officers to maintain vigil and make further interventions to enhance the level of preparation. Listeners, that was a special roundup on COVID-19 brought to you by the regional unit of All India Radio. Please stand by for the program that follows.